Hi, today we're going to talk about mole checks and the important things to look for. It is important that we be vigilant for the moles that we currently have, but also the ones that we may potentially develop. The simple things with any mole checking is to do it regularly, so every 3 months as a rough rule, but also to make sure your entire body is checked as well. And that means just looking top to toe, head to foot, in any area where there is some skin. So the back of your bottom, parts of your soles of your feet, all these areas can in theory develop a mole and a potential skin cancer as a result. It is not purely just sun exposure on its own that can cause melanoma skin cancer. Often it can be hereditary, sometimes it's a greater risk in those who are fair-skinned and also those who have lots of moles. But also another risk factor is sun exposure and blistering sunburn as a child. With all of these risk factors in place, it still doesn't mean that you can just sit at home and do nothing. The most important thing is for you to take control and to check your own moles. It's normally pretty easy to spot what we call the ugly duckling. So this is a mole that just looks different from all your other moles. It's often dark, it's often flat, and it often doesn't really cause any symptoms. If you've got a mole that looks different from all your other moles and is changing, then that's something to keep an eye on, or maybe if you're concerned, go and see your doctor. I hope that helps, just giving a rough glossary of what melanoma skin cancer checks are all about. Remember, the simple things are to be done at home, which is check regularly, and if in doubt, check it out. Hope that helps.